Shaken baby syndrome. Shaken baby syndrome, also known as shaken impact syndrome, is a serious form of abuse inflicted upon a child. It usually occurs when a parent or other caregiver shakes a baby out of anger or frustration, often because the baby will not stop crying. Babies have very weak neck muscles that cannot fully support their proportionately large heads. Severe shaking causes the baby's head to move violently back and forth, resulting in serious and sometimes fatal brain injury. Shaking with or without the sudden deceleration of the head when it impacts the surface can cause the following: subdural hematoma, which is a collection of blood between the surface of the brain and the dura. This occurs when the veins that bridge from the brain to the dura are stretched beyond their elasticity, causing tears and bleeding. Direct trauma to the brain substance itself, caused when the brain strikes the inner surfaces of the skull. Shearing off or breakage of nerve cell branches, axons in the cortex, and deeper structures of the brain caused by violent motion to the brain. Further damage to the brain cells when injured nerve cells release chemicals that add to oxygen deprivation to the brain. Other injuries related to this abuse include skull fractures resulting from impact when the baby is thrown against a hard or soft surface. Fractures to other bones, including the ribs, collarbone, and limbs. Bruising to the face, head, and entire body. Prevalence and incidence. This syndrome is primarily seen in children younger than age 2, with the majority of cases occurring before the baby's first birthday. The average victim is between 3 and 8 months old. The National Center on Shaken Baby Syndrome estimates that there are between 600 and 1,400 cases in the U.S. a year. Because there is currently no reliable method of collecting these statistics, the true incidence is unknown. Symptoms and signs. There is often no obvious external evidence of injury or physical sign of violence, resulting in underdiagnosis of this syndrome. Caregivers and even physicians who are not aware of what has happened to a baby may not detect injuries that are primarily internal, attributing the baby's fussiness to an underlying cause, such as a virus. Symptoms vary and are caused by generalized brain swelling secondary to trauma. They may appear immediately after the shaking and usually reach a peak within 4 to 6 hours. The following signs and symptoms may indicate shaken baby syndrome. Altered level of consciousness. Drowsiness accompanied by irritability. Coma, convulsions or seizures. Decreased appetite. Vomiting. Breathing problems and irregularities. Cardiac arrest. Death. Physical findings upon medical examination. Retinal hemorrhages. Subgilial. Lacerations. Contusions, concussions, abdominal injuries, chest injuries, abnormally low blood pressure, tense fontanelle soft spot. The prognosis for victims of shaken baby syndrome varies with the severity of injury, but generally is poor. Many cases are fatal or lead to severe neurological deficits. Cerebral palsy, paralysis, vision loss or blindness. Mental retardation, epilepsy, prevention. Shaken baby syndrome is completely preventable. Taking care of a baby can present challenges, especially for first-time parents. The following tips may help prevent abuse. Take a deep breath and count to 10. Take time out and let the baby cry alone. Call someone for emotional support. Call a pediatrician. There may be a medical reason why the baby is crying. Never leave a baby with a caregiver, friend, or family member in whom there is not complete trust. Always check references carefully before entrusting a baby to a caregiver or daycare center. If you learn anything from this video, let us in the comment below, and don't forget to like and subscribe our channel for future interesting videos. Thanks for watching.